Hi, I'm Dr. Robert. Today I'll be explaining HIV and its symptoms. There are plenty of videos about this topic on YouTube, but I'll explain it in my own simple and direct way. No unnecessary talk, just straight to the point. So let's get started. Some diseases announce themselves with pain. Others, like HIV, begin in complete silence. For many men and women, HIV doesn't start with sickness. It starts with invisibility. You look fine, you feel fine, but inside, the virus has already begun rewriting the immune system line by line. Today we're going to talk clearly about what HIV actually is, what it does inside your body, the real early symptoms, and how modern treatments have changed everything. And before we begin, we're only 92 subscribers away from reaching 1,000. Your small click of support helps us keep spreading medical truth and save lives through awareness. Thank you for being part of this journey. Let's start at the beginning. HIV stands for Human Immunodeficiency Virus. It's a virus that specifically targets one of the most important cells in your immune system, the CD4 T cell, also called the helper T cell. These cells are like the generals of your body's defense army. They coordinate how your immune system responds when bacteria, viruses, or other invaders attack. When HIV enters your bloodstream, usually through unprotected sexual contact, blood-to-blood exposure, shared needles, or from mother to child during childbirth or breastfeeding, it searches for these CD4 cells. Once inside, HIV uses an enzyme called reverse transcriptase to copy its own genetic code into the DNA of the CD4 cell. That's what makes HIV unique. It doesn't just attack you, it becomes part of you. Every time that infected CD4 cell multiplies, it produces more copies of the virus. Over time, as the virus multiplies, the number of healthy CD4 cells falls, and your immune system slowly weakens. But here's the part most people misunderstand. This process can take years, which means for a long time you may not feel anything at all. That's why HIV is called a silent infection. After initial exposure, there's an early phase called acute infection, which usually happens in the first 2 to 6 weeks. During this time, the virus multiplies rapidly. Some people might get mild fever, fatigue, swollen glands, or sore throat symptoms that feel exactly like a seasonal flu. But then, the immune system starts to fight back and brings the viral load down. That's when HIV enters a clinical latency phase, also known as the asymptomatic stage. In this stage, the virus doesn't disappear. It hides. It keeps reproducing quietly inside the body, slowly chipping away at the immune system. This stage can last anywhere from 5 to 10 years, depending on the person's health, lifestyle, and treatment status. And during this time, even though a person looks completely healthy, they can still transmit HIV to others. That's why awareness and regular testing are so important, because absence of symptoms is not absence of infection. The earliest symptoms of HIV can be incredibly subtle. Let's go over them the way a doctor would. Fatigue that doesn't go away with rest because your immune system is constantly active. Fever or night sweats due to low-grade immune response. Swollen lymph nodes, especially in the neck, armpits, or groin. Weight loss, even without trying. Mouth ulcers, thrush, or persistent skin rashes. Many men mistake these for stress, workload, or common infections. I've seen patients who thought it was just flu or gastric weakness until routine testing revealed the real cause. Remember, HIV doesn't target a specific organ. It targets the system that protects every organ, so the symptoms are scattered, general, and easy to overlook. As HIV continues unchecked, CD4 levels drop. A healthy adult usually has 500–1,500 CD4 cells per microliter of blood. When the count falls below 200, the immune system becomes dangerously weak, and that's when HIV progresses to AIDS, acquired immunodeficiency syndrome. At that point, your body struggles to fight even basic infections, like tuberculosis, pneumonia, or fungal infections. You may see conditions like oral thrush, white patches in mouth, shingles, chronic diarrhea, rapid, unexplained weight loss. These are opportunistic infections, illnesses that a normal immune system would usually destroy within days. But in someone with advanced HIV, they become serious threats. This stage is still treatable, but it's much harder to reverse the damage. That's why early detection is everything. Testing for HIV is simple, accurate, and widely available today. There are 3 main types of tests. Antibody tests. These detect antibodies your body produces against HIV. They're reliable after about 3 months of exposure. Antigen/antibody combination tests. Fourth generation. These detect both antibodies and parts of the virus itself, usually conclusive within 4 to 6 weeks. RNA-PCR tests. These detect the virus's genetic material directly and can confirm infection as early as 10 to 14 days after exposure. Modern hospitals now use ECLIA, electrochemiluminescence, testing for high accuracy. If you test positive, the next step is a CD4 count and a viral load test. These help doctors measure how strong your immune system is and how much virus is present. Early diagnosis allows treatment to start before irreversible immune damage occurs. That's the difference between living healthy for decades or struggling with late-stage complications. The biggest myth about HIV is that it's a death sentence. That hasn't been true for decades. Thanks to antiretroviral therapy, ART, HIV is now a manageable chronic condition, not a fatal one. ART uses a combination of medicines that block different stages of the virus's life cycle. Some stop the virus from entering cells. Some block reverse transcriptase so the virus can't copy itself. Others prevent integration into DNA or stop assembly of new viruses. Taken correctly, once daily ART can reduce the viral load to undetectable levels, meaning the virus can't harm your immune system. You can live a completely normal lifespan. And most importantly, undetectable equals untransmittable. People on effective treatment cannot pass HIV to others. This is one of the most powerful scientific achievements in modern medicine. In 2025, new long-acting injectable options are also available, lasting 1 to 2 months per dose, ideal for those who struggle with daily pills. The key is consistency. HIV doesn't grow resistant when treatment is taken as prescribed. Preventing HIV today is straightforward, but it requires awareness. Use protection during sexual contact. Never share needles. Ensure blood transfusions are from screened sources. And get tested regularly, especially if you're in a higher risk group. There's also a preventative medication called PrEP, pre-exposure prophylaxis, a daily pill that dramatically lowers the risk of infection. But beyond medicine, prevention is also about mindset. Knowing your status isn't fear, it's responsibility. Getting tested doesn't make you weak, it makes you wise. HIV doesn't just attack your immune system, it attacks awareness. It grows strongest when people assume, I look healthy, I must be fine. The truth is, you can't see HIV in a mirror. You can only see it on a test. So if you've never been tested, make today the day you take control of your health. Early diagnosis, modern treatment, and honest education. These 3 things have turned HIV from a global killer into a controllable condition. Thank you for watching. Subscribe, share, and help us reach that 1,000 subscriber milestone, because awareness saves lives.